And I recall one of the mothers calling me, like I think a few weeks after the program concluded. And she was telling me that my son wakes up every morning excited, cooking breakfast, not just for him, for the whole family.
Oh, that's so lovely.
So this is the kind of feedback you'd love to hear.
Some people don't just work in healthcare, they work to change it, to make it fair, inclusive, and truly reach those who've been overlooked for too long. Today's guest is one of those people. Areen Abuhejleh is Head of Health at Special Olympics UAE and a Public Health Ambassador at Abu Dhabi Public Health Centre. With over 14 years of experience in nutrition and public health, she's been designing programs that include and empower people of determination. Irene believes healthcare should be fair and deeply human. Today we'll explore what that means and what it takes to get there. Irene, welcome to Enara Talks. I've been really looking forward to this conversation.
Thank you for the lovely introduction. It is indeed a pleasure to be here with you and the whole team behind Enara platform.
We're so excited to have you here. So let me start with my first question, which is, as Head of Health at Special Olympics UAE, you lead initiatives that promote well-being and inclusion for athletes with intellectual disabilities through education and support. What does this role mean to you professionally and personally?
Professionally, I believe anyone working for the Special Olympics, not just in United Arab Emirates, around the world, or even had the opportunity to volunteer within our programs, must have had a rewarding experience. And you can see that from the commitment of our volunteers, the familiar faces that I see in our events, and in addition to that, them always asking us, when will the next event be taking place? Back in 2019, Abu Dhabi hosted the World Games. And if you allow me to emphasize a little bit about the World Games.
Yes.
So it's a global event, international event that takes place once every 4 years, just like the Olympics. However, the Olympics was created for athletes who are neurotypical. The Special Olympics or the World Games event, all the programs under Special Olympics are created for athletes who have an intellectual and a developmental disability. Then you have the Paralympic, which is created for athletes who have physical disabilities. And I wanted to highlight the differences between both because a lot of people perceive Special Olympics is also the Paralympic.
Yeah.
And in 2019, the World Games took place for the first time in the MENA region, specifically in Abu Dhabi. And back then, I used to work in a leading health insurance company, and I got the approval from the management to the privilege to volunteer for 5 consecutive days in the World Games, specifically in the Healthy Athletes. So the Healthy Athletes is a global program under Special Olympics.
Right.
And it's a free health screening that is created for our athletes. And the way that it works is unlike any other screening. It covers 9 different disciplines, whether it's a hearing examination, a dental oral health examination, or an eye examination. And in a very fun, welcoming environment, you'll see colors everywhere. We try to veil away from the clinic vibes. So you won't see any white coats there. And I was appointed in the health promotion discipline. The health promotion is all about nutrition, smoke cessation, and sun safety. And holding a background in nutrition, they found my position to be there. And I remember the first day I walked into the hall. It was massive. I had no idea how big this event is. And I met coaches and athletes from all around the world. And I made so many friends. Every night when I left the hall, I was just thinking about the next day when I just want to go back and see them. And I had this sense of belonging. I felt like this is where I want to work.
Wow.
So yeah, currently holding this position, I wasn't working for Special Olympics back then. Right now with what I do is that I ensure that I create programs and lead initiatives that work around ensuring we have an inclusive health ecosystem. Whether it's the screening programs, the Healthy Athlete that I talked about, or training programs that we work on and dedicate them based on the targeted population, or leadership programs like the Health Messenger. And I believe Dinal was here in one of the previous episodes, and he talked about the Health Messenger program. We're not just closing gaps, we're trying to build long-term sustainable programs that break barriers to ensure we have inclusion everywhere. And in addition to everything that I mentioned, to answer your question from a personal perspective, with all the passion that I have towards people of determination and Special Olympics, it is truly amazing to be standing alongside athletes who break barriers simply by being who they are. Our athletes work really hard. They compete around the world, nationally and globally, and they represent United Arab Emirates, and they come back home with so many medals. And, seeing the effect of our programs, building their resilience and their confidence and the support we've been giving to the parents, it's not just about health. We're trying to transform lives.
It's really inspiring listening to you about your journey. Why don't you tell us a little bit about what your typical day looks like? Because I'm sure, seeing that you're working on all these interesting initiatives, one day is probably not like the next.
So when I first started working with the Special Olympics back in 2020, there was no dedicated health department. And I was assigned to work on the Healthy Community project. The Healthy Community is a program with a recognition that any country around the world that has Special Olympics headquarters with some health programs being running, the opportunity to apply for this recognition. And the way that this project works is in a holistic approach, having our athletes. So when I refer to athletes, I mean people with intellectual and developmental disabilities, having them as the core of the whole project. We work closely with the caregivers around them. So whether being the mother, the father, or the coaches, and then we have other important pillars and stakeholders, such as the healthcare providers, universities and schools, and of course, regulators, the government, NGOs and private sector. We work together in a holistic approach to ensure accessibility when it comes to health for people of determination. And when I started working on this project, there were only 3 initiatives running. The screenings, but not all disciplines were active, and there were family forums, and there was the health messenger. And day by day, we started working on the KPIs. So you need to fulfill those KPIs to get the title. And we were seeking support from different stakeholders. And what really helped us within this project was when the World Games took place in Abu Dhabi in 2019, it created a shift in the mindset of so many people and so many organizations. Whenever we met any stakeholder, they immediately remember the World Games that took place in Abu Dhabi. The whole city was talking about it. And the support that we got from the leadership, the vision and mission that they have for people of determination have helped us with this project. So by the end of that year, we were able to achieve all KPIs, and the United Arab Emirates was the very first country in the MENA region to attain the Healthy Community title, making it the first country in the MENA region to achieve it. And I recall the day it was COVID, we went and we presented the plaque. So we received the plaque from SO, Special Olympics International, and we went to the palace, we presented it to His Highness alongside with our partners, just to show them how their support is effective and where have we reached with their support in this project.
That is incredible. And this project has led to many people's lives being impacted positively. We'll talk a little more about that. But I also wanted to touch upon the fact that as a public health ambassador at Abu Dhabi Public Health Center, you're helping shape healthier communities across the UAE. What drives your passion for public health?
Public health is all about raising awareness, and any individual who is equipped with the right knowledge that is evidence-based is responsible in sharing this information with the people around him. And, it's really surprising to see how just a small health tip can have a huge transformation on someone else's life. People come from different backgrounds, and not everyone has enough nutrition literacy or health literacy or knowledge about health and nutrition. And myself being a bookworm and always updating myself with the latest research when it comes to health and longevity and physical activity, I try to make it a point that I want to share this knowledge with the people around me, maybe through social media or being a public health ambassador. In addition to that, I embed the nutrition element in most of the programs that I have at Special Olympic. You'll see there's a bit of nutrition here and there. And the reason why is, unfortunately, people of determination are more likely and susceptible to develop chronic conditions and diseases and lifestyle diseases due to their genes, which means here prevention is key. When you provide them or their caregivers with the right knowledge, taking baby steps can help and prevent the onset of certain diseases and sometimes delay. So I'm always passionate, and seeing outcomes, just giving small tips and guidance to people and see how their life transforms later on is completely rewarding to me. It's truly a mission.
It makes sense. Despite the progress we've made, access to quality healthcare, especially therapy and early intervention, there still remains a challenge for many people of determination when it comes to healthcare. Where do you think the healthcare system still falls short in supporting individuals with special needs? And I think this question's applicable not just here, but generally across the globe. So that's why initiatives like the ones you work in work. So maybe you can give us a little more details on that.
You're completely correct, and I've seen this, we tend to travel a lot with our athletes in different events, and it is truly a big challenge. In Special Olympics UAE, we've been working for the past 5 years on a unique, tailored, evidence-based training program for healthcare professionals and interfacing staff that work in the hospitals. And what we're trying to do is to smoothen the whole patient journey. So whenever a POD goes to a hospital to his appointment, and due to their condition, it should be more often. However, this isn't the case due to bad experiences that they went through in the past. Not everyone knows how to communicate with people of determination. So in this training program, we provide compassionate healthcare for the medical staff, whether being a physician, a nurse, or radiologist, and interfacing staff who are non-medical, such as the front desk staff or customer patient experience. And we equip them with the knowledge, again, going back to evidence-based and having a certain team who are specialized in delivering this training. And when a certain number of employees undergo this training and they pass with the quiz, the whole hospital gets accredited, meaning that a certain percent of employees in this hospital has individuals that knows how to communicate with people of determination. And this will make life easy, not just for the patient, the POD, also for the caregiver and the physician himself. And, up to this date, we have trained, I think, over 1,400 employees and 56 accredited hospitals across all United Arab Emirates. We're very proud of this program because not anyone who works in a hospital, and that's what a lot of caregivers perceive, knows how to communicate with people of determination. You either get this experience having a family member or a close friend who is on the spectrum or, has an IDDD, intellectual developmental disability, or from experience in life, or maybe you took a training when you were in university. And for that reason, going back to the holistic approach, a similar training was created to focus on medical students. So we're trying to prep them before they start working in the hospitals. And that's how another program was created called the Inclusive Healthcare Training. So you have the Unified Healthcare Training for the hospitals and the Inclusive Healthcare Training for medical students. And what we do there is it's either we touch around the curriculum by meeting, the deans from different faculties under health, to change the curriculum to make it more inclusive. If that's not the case, then we provide the free of charge training and we equip the students with, again, going back to compassionate healthcare, elevate their relationship with their patients and provide them with de-escalation techniques when it comes to stressful situations.
I think it's incredible that the healthcare system is being remodeled to support people of determination. And it's great that you're involved in these initiatives. I think it starts right from the beginning as well, from the homes, which is why we focus on early intervention as well. Just moving on, it's very clear you mentioned your nutrition background and how you love to read and the joy that comes to your face when you talk about all the different things that you're working on. So it's very clear that you're very passionate about what you do. And I can see you're a strong advocate for inclusive healthcare, ensuring that people with disabilities receive the same quality of care as everyone else. How do you define real inclusion in healthcare?
So as mentioned, we've been working really hard when it comes to the communication element. And I think it's very crucial when it comes to accessibility with the language to use something that is very simple, very clear for people of determination. And to identify that this patient is from the POD community upon arrival to the clinic, or even just when doing the phone call, in a way where we ensure that we approach them in a holistic approach and take into consideration their mental and their physical well-being. We've seen this in a lot of our screenings. A lot of the athletes who show up for our screenings don't know how to express pain. So we run the screening, and on spot, we would have one of the clinical directors. So just to explain the term here, clinical director is a physician who's volunteering with Special Olympics and undergoes a specific training that allows him to conduct those screenings with us on the ground. And, he would call me on spot that we need to send off this athlete immediately to the hospital due to their condition. I recall once we had one of our athletes who fainted. And, when we had the medical staff, gather around, and it was just a really bad abscess in her teeth. They just can't point and say the pain is coming from here.
Yeah.
So the way that the physicians and the interfacing staff dealing with the patients from the POD community should be in a holistic approach, just to ensure, that everything that can be done for them is being delivered.
I think it's a very strong point that you make. And supporting the communication journey is one of the initiatives. Can you share an initiative or a change that's made a meaningful difference in the community other than this one?
A couple of years back, Special Olympics United Arab Emirates have been selected alongside with 5 other countries to work on the GATES project. And the GATES project focuses on athletes or kids ages 2 to 7 who have intellectual or developmental disabilities, alongside with their caregivers, being either the mother or the father. And this program was supported by the Bill and Melinda Gates Foundation. And it had 3 pillars. One was called the Healthy Young Athletes. So it focuses on developing the motor skills and the social skills of the kid over a period of 8 weeks. And then there was the Family Forum. So the Family Forum is a forum where you bring families and we cover a certain topic with a subject matter expert. And we leave room for Q&A. And then there's the Healthy Young Athletes screening, the pediatric screening. And it was my very first time to work on this screening. I found it extremely challenging because it covers so many aspects. It's a physical examination, a behavioral examination, speech therapy. And we provide lots of resources for the families who come into the screening. And it takes around 1.5 hours for every athlete to go from, point 1 till the end of the whole journey. Mm-hmm. And when we were done with the screening, it took a period of 2 days and we covered 100 children. The findings were where we decided that this is something we need to focus on for 2 reasons. One, a lot of the kids who came have never done an eye examination before or a dental examination. Thus, so many dental caries and gum issues were identified. And lots of speech therapy referral was, concluded when we looked at the data. And we realized, looking into literature, because most of the programs focus on 8 and above. Mm-hmm. 2 to 7 is very crucial and important because at this stage, when you have early intervention, it can have massive impact.
Speaking of which, you mentioned like the dental work and not being able to identify when a person of determination, a child particularly, isn't able to highlight if they have an abscess in their mouth or something. This leads into my next question, where your work in health education focuses on empowering people with intellectual disabilities, obviously, to make informed, healthy choices. How do you adapt your education strategies to make them more accessible and effective?
So we adapt by being where the athletes are. And we've got plenty of programs, one of which the Cooking Club program that has lots of educational resources. And then we also have the Fit 5 program, which is a fitness program that runs over a period of 8 weeks. And I love this program because, from the name, it focuses on the number 5. Eat your fruits and vegetables 5 times a day, and exercise 5 times a week, and drink your water, 5 water bottles a day. And there's, again, lots of educational material within this program. And we have realized that the repetition model works really well with people of determination. And we use materials that, the way that we develop the material is very simple, very clear, lots of diagrams and colors. And also we discovered the peer-to-peer method being way more effective. And I'll give you an example with the Health Messenger program. So the Health Messenger, we're creating health advocates, and we train them over a period of 2 to 3 days. And we cover different topics about health and mental health, emotional intelligence, safeguarding, advocacy, and public speaking skills. So equip them with all of this information. And then in return, their role is to spread this information with the community and the people around them. And we have found that the peer-to-peer model, a health messenger spreading the information, is way more effective than me speaking to the POD community.
Of course. It makes sense. People relate to people they can identify with. Yeah. So it makes a big difference. And it's a smart initiative and a better way of doing things effectively. You've led a few initiatives, from speaking at the Disability Inclusive Innovation Summit to creating training programs for healthcare professionals. Which project has stayed with you the most, and why?
I would have to say the Cooking Club program.
Okay.
It's very popular. This initiative, when it launched, the plan behind it was to run cooking sessions in a kitchen or in a hotel. But then COVID was there and we had lots of restrictions. And one of our KPIs is to run a wellness program for at least 6 weeks that touches around whether physical fitness, nutrition, and so on. And, the program launched, and year by year, it has been very popular. And what we do in this program is that we cook a healthy, nutritious recipe. And each of the participants is, behind the computer in their own kitchen with their loved ones, cooking a nutritious meal. Meanwhile, we're providing them with tips about nutrition, and then going back to the repetitive model that we just talked about, a very interactive way, in addition to sustainability and kitchen safety. And year by year, the program has evolved. So for instance, last year, we ran the session finale on the ground. So we've been cooking for 5 weeks online behind the screen, and we got to meet each other in the last session, and we cooked a very delicious, high quality meal. We ate it together, and their family members were with them. We called out their names. They all got a certificate, and we had wonderful partners in that program that elevated. And I really look forward to this year's intake. We're launching in October, and we have delicious new recipes. So once the program closes, we conduct, a survey, and we have this before and after questionnaire where we talk to the parents and get their feedback about the program. And it's just amazing, how some of them have never been into the kitchen before.
Right.
Never, ever the sandwich or touched the stove. And I recall one of the mothers calling me, like I think a few weeks after the program concluded. And she was telling me that my son wakes up every morning excited, cooking breakfast, not just for him, for the whole family.
Oh, that's so lovely.
So this is the kind of feedback you'd love to hear.
That's true. Yeah. Are you doing anything different for the next program versus the one that's just passed?
You have to stay tuned.
Oh, we'll pay attention and follow along to see what you guys do. So on to my next question. You've partnered with government entities, NGOs, academic institutions, and private sector organizations. How do you bring such diverse stakeholders together whilst keeping inclusion at the core of your work?
So we bring diverse stakeholders together by anchoring everything in a way where we provide them with a clear path towards impact. And regardless what stakeholder we're working with, again, with the work that I do on a day-to-day basis, we communicate with so many different stakeholders because we're going back to the healthy community. Without stakeholders, we cannot achieve, anything that we're doing. We're a nonprofit organization, a very tiny team, yet we have huge KPIs. And it's all about shared values. We don't speak to the partners just asking for support. We try to co-create solutions where they can see the impact of their work on the ground. And a true partnership, and a successful one, can happen when people don't see themselves just as participants but as co-leaders of the whole mission.
So why don't you tell me a little bit more about the different stakeholders that you're working with, because they are contributing to the impact we're seeing here?
I'll give you an example. For instance, the University of Sharjah have tremendously supported us with the Special Smile screening by providing the mobile dental clinic that gives us the opportunity to do on-spot treatment. So when we conduct the screenings, we don't do on-spot treatments. It's just, identifying what the problem is. But when you have the mobile dental clinic with you, they support in the treatment. In addition to all of that, we always ensure if any of our athletes have a health problem, we close the loop by shifting them to a follow-up care program. And this is where we build partnership with different healthcare providers that ensures that if there's any health problem, an appointment is taken and, the whole health problem is being resolved. And we have free follow-up sessions with University of Sharjah. And we also have great partnership going back to the dental or the special smiles with Apollonia World. They've supported us in providing lots of equipment for our screenings and volunteers, and also with the follow-up care. So any of our athletes who had serious problem in their teeth that cannot be covered in insurance, they just take care of it free of charge. So this is just a small example with the special smiles. We also have in the opening eyes, which is an eye examination, strong partner called One Sight. So it's an international partnership. When we conduct the screening, any of the athletes who have problem with their eyesight and need new prescription glasses, they take care of the whole process from the lens to the frame. And they also give sunglasses for the other athletes, for sun safety.
It's so good to hear that you have these entities being supportive, and it is really important for healthcare providers to be involved, to provide this kind of support, because if we don't work together as a community, we will not elevate ourselves as a total community as well. And that's what I'm hearing over and over again with some of the answers that you've given today. I wanted to touch upon technology. So especially AI, we all know it's coming and we're seeing all the changes. It's reshaping healthcare with new tools for learning, support, and access. How do you see artificial intelligence and platforms like Enara improving the well-being of people of determination?
I think AI is a unique opportunity to personalize care and upscale education, and by no doubt, it is the future. And having wonderful platforms like Enara gives the opportunity to, provide accessible health content that can be tailored based on different cognitive abilities out there. And it can also help in closing the gaps when it comes to education by tracking and monitoring and somehow empower athletes in making their right choices when it comes to their own health.
My next question to you is, what innovation would you like to see next? Do you have some ideas?
I know there are a lot of platforms or applications out there that are currently running, but I feel with some of the challenges that we have when it comes to people of determination, I would love to see an AI tutor. Because, a lot of parents complain about the costs when it comes to early intervention and education. It's a huge financial strain and burden on some of the fathers. So if you have an AI tool that can tutor the athlete or the individual with IDDD based on his needs and focuses on his weaknesses, is something that I would really love to see. Or focus on their overall health by having a daily companion. and that helps them in making the right choices, and kind of reflect through certain monitors or wearables that they can wear, and that can be presented to the physician upon going to the clinic, because as mentioned before, they don't know how to express pain. It can give an overall glimpse for the physician where the problem is, that maybe this way it can help in better prevention. It can also have some kind of reminders, set them realistic goals that are smart, and also, I would say, communication. Going back to communication, each athlete or each individual on the spectrum or with an intellectual disability has his own way of communicating. And I feel like having a specific application that can adapt based on his language, that can later on be reflected to the people around him, might be extremely beneficial and useful.
These are some great ideas. I know right now when it comes to AI, there are things being developed when it comes to digital twins and like a digital companion. So I'd like to see that incorporated for people of determination overall. I think it would make a big impact. So these are some of the innovations we can look forward to, and I think in the near future as well. Okay, so my last question to you is for the parent or the caregiver who's listening today, who may be feeling overwhelmed. What would be your advice to them?
You're not alone. There are a lot of families who are going through the same situation that you're going through. I know it is individualized and different for every child. However, I feel like the support that needs to be given for the family members depends on the stage that they're going through. For instance, family members who have just identified that their child has an intellectual or a developmental disability, whether being during pregnancy or upon giving birth or a few years, which is the case with autism, they need to be immediately somehow involved or supported in a support group. Look for people who are going through the same experience, because with all the programs that we've had and looking at the family forums, when parents speak towards the end of the session and talk about their experience, it is way more effective than anything else. Try to check certain, I would say, groups or platforms such as Enara, where you can find other family members who can support you, and always ask. Again, you're not alone. There are a lot of people who are going through this challenge, but with time, and we've seen it in Special Olympics, most of our successful athletes are successful because of their parents, their resilience, and I would say the mothers play a very important role. When the mother is strong and she knows what she wants, and she sets certain goals on where she wants to go next with her child. And I know it, again, going back, it is extremely challenging because it's a new experience. But every parent who we know keeps saying that having a child on the spectrum or with an intellectual disability is one of the best gifts they've ever had.
That's incredible. And I know we didn't talk about this, but to touch upon the fact that the mothers carry the burden, have you seen in your experience or any initiatives that have been supporting mothers?
We tried to conduct a couple of programs that were running for 8 weeks for mothers, because I believe mothers are the foundation of every house. And when the mother's mental health well-being is not doing okay, the whole house collapses. And from the first session that we had, you can tell the amount of stress that they're facing. And a lot of them were crying. And then in the next and the third session, we started to see absenteeism. A lot of them were not showing up. And when we call them, they simply say, I feel guilty leaving my kids and coming here. I just can't, I have to be with my child. But, and this is a message for the mothers. They need a me time. They need to focus on themselves. They need to have some time for them to be able to power up, to stand up, not just for their child, for the whole house.
Thank you so much, Irene. Honestly, thank you for coming and your message has been very empowering. I'm sure there's many people out there who'll be able to connect and feel like maybe for their children who are young and would like to become athletes or otherwise just be more involved in understanding better health and the implications of it. It's going to be very useful. So once again, thank you for coming in.
Thank you so much. It was indeed a pleasure being here. And I hope the message being delivered to anyone who's listening will have an effect on their lives.
To everyone listening, if this conversation made you pause, reflect, or see healthcare a little differently, please share it. Conversations like these deserve to travel far. This is Enara Talks. Stay kind, stay curious, and keep believing in better.